Stem cells are the alpha and omega of your body's ability to heal itself. Without stem cells, minor injuries become fatal. What are they? Stem cells are unspecialized cells that lie functionally dormant until there arises a need for new, specialized cells to carry out tasks within the body. Upon injury, these miraculous little cells begin the process of differentiation to produce the cells that can rebuild tissue and fight disease.
The clinical promise of stem cells is enormous, being mentioned in over 3 million scholarly papers. However, given that the only FDA-approved stem cell treatment is the bone marrow transplant, we are still many years away from safe, effective, clinically applicable stem cell treatments. The enormous degree of stem cell hype, in conjunction with a general lack of knowledge of the risks and efficacy of treatments, have bred a dangerous new industry: for-profit stem cell clinics.
These bogus clinics promise safe, effective treatments for a myriad of diseases from asthma to cancer, according to UC Davis Associate Professor and stem cell blogger Paul Knopfler's stem cell database. The U.S. Stem Cell Clinic promises stem cell treatments for multiple sclerosis, diabetes, traumatic brain injury, and many more afflictions, according to the FDA warning letter sent to the clinic in August of 2017. Seeming too good to be true, our team decided to investigate the legality, efficacy, marketing practices, and safety of the treatments provided by the U.S. Stem Cell Clinic.
We started by simply visiting the clinic's website. The website and clinic look legitimate enough with a quick scroll through, with a professional layout, easily accessible patient testimonials, and a very brief description of the services offered. However, upon further analysis, the website provides the first clues that this is a questionable operation. Most of the website appears to be marketing-oriented rather than medical, with only one page describing the services offered by the clinic. Furthermore, the clinic uses only one vague sentence to describe their stem cell treatments, an incredibly dangerous procedure. They say nothing about how the procedure is conducted, possible side effects, or other important information. Additionally, the clinic makes no effort to hide that their treatments are not FDA approved, posting their response to the FDA warning letter they received in 2017.
In their response, the U.S. Stem Cell Clinic claims that they do not manufacture biological drugs and minimally manipulate the biological components that they collect from patients, and therefore qualify as an exception to FDA regulation and are not subject to it. In their warning letter response, the clinic admits to using a technique commonly referred to as stromal vascular fraction, in which an enzyme is used to separate the fat tissue obtained during liposuction from the stem cells in the tissue. This is the first concrete evidence of law-breaking by the clinic, as the FDA has specifically defined stromal vascular fraction, or SVF, as more than minimal manipulation, and therefore clinics practicing SVF are subject to FDA regulation.
The following quote was obtained directly from the FDA regulation regarding this practice. The FDA states that cell isolation would typically cause the adipose tissue to be no longer such HCTP, and the establishment would generally not be considered to qualify for the exception. FDA regulations are law, and since the clinic refuses to adhere to regulations, they are breaking the law.
The FDA conducted an investigation of the U.S. Stem Cell Clinic with horrifying results. The FDA explicitly stated that the clinic's SVF product does not meet the minimal manipulation criterion. On top of the obvious evidence of lawbreaking, the FDA found that the clinic failed to properly sanitize equipment in other areas. The U.S. Stem Cell Clinic failed to use disinfectant agents that are appropriate for the use of cleaning and showed no record reflecting that cleaning, sanitizing, and inspections of equipment have been performed prior to, during, or after the manufacture of each batch of SVF product, according to the FDA warning letter. Perhaps as a result of these unsterile medical tools during procedures, the FDA additionally found various injuries as a result of treatment from the clinic, with the blinding of 2 patients who went in for treatment for macular degeneration on June 16, 2015 and May 15, 2016. This led us to the question, are these risks being disclosed to consumers? A direct quote from the clinic's website read that, side effects are typically minimal and may include minor pain and irritation at the injection site. Since we are using a patient's own stem cells, chances of immune system rejection are extremely low. Extensive research and testing using adult stem cells is ongoing worldwide, and very few adverse effects have been reported. As one can see, the clinic gives no mention of injuries that have occurred as a result of their treatments, or even admits that they are very possible. The clinic is clearly being marketed as far more legitimate than it is. Kristen Comella, the chief scientific officer for the clinic, has a legitimate degree in chemical engineering, but her PhD in stem cell biology is from a 3-year online university in Panama. She published the only paper providing evidence of the safety and efficacy of the U.S. stem cell clinic's treatments. The paper states that the procedure demonstrates exceptional patient safety, and the study underscores the safety of autologous stem cell therapy in general, almost completely disregarding the 3 deaths that occurred over the course of the bogus study.
We wanted to see how they market their procedures and present information directly to consumers. So, we called the clinic, posing as a potential patient. We asked about the success rates of 3 aggressive diseases they claim to treat: Parkinson's, ALS, and COPD. Let's take a listen.
U.S. Stem Cell Clinic, this is Brittany. How can I help you?
Hi, I just had a few questions based on like the success rates of some of your treatments. I was wondering if I could ask.
Okay, yes, absolutely.
Okay, so for Parkinson's disease, do you know what the success rate for that particular treatment is?
I do not. I know our patients have seen benefits. However, since it is a progressive disease,
Mm-hmm.
obviously we're not, trying to cure anything. We're just trying to minimize symptoms and prolong, like life expectancy and quality of life.
Okay, that makes sense. Would that be the same for ALS too?
Yes.
And I don't know if it'd be any difference for like COPD, but
So with our COPD patients, again, I don't have statistics. Our
yeah.
medical staff knows more about that. But our COPD patients, generally, I've had one of our patients come off a lung transplant list.
Mm-hmm.
They're using less oxygen. Some of them are going from 6 liters to 2 liters as needed. Some are off of it completely and decreasing medications.
Oh wow.
Their pulmonary function tests are increasing. Yeah, as much as like 7 to 10%.
Wow, that's good.
Mm-hmm.
So would there be any way to find any like success, like actual number success rates, like anywhere like on your website or by like
I know we have an article. I don't know if that necessarily has the success rates or not.
Mm-hmm.
Just because we don't have like studies like that going on.
Oh, gotcha.
Yeah, at this moment we're just treating patients.
Contradictions, ambiguity, and vagueness seem to be widespread throughout the U.S. Stem Cell Clinic. In another call to the clinic, we asked about the procedure they use in their stem cell treatments. They delivered a clear message regarding the extraction of the adipose and bone marrow stem cells, but were incredibly vague about how they process the stem cells and about how those are put back into the body, likely because that is what a large part of the clinic's illegality comes from. The website says that a certified physician's assistant will perform your procedure, but nothing about whether or not this person has any training in stem cell biology.
The clinic also claims that their procedures are clinical trials. However, according to an article in the New England Journal of Medicine, the U.S. Stem Cell Clinic is charging patients over $5,000 for treatment, disqualifying it from clinical trial status. The U.S. Stem Cell Clinic also only follows up with patients in their so-called trials by phone, 1 year after receiving the treatment, which is not on par with the usual rigor and intensity of credible clinical trials. The clinic spent about $4,000 itself on research, while spending over $3 million on marketing, according to the clinic's SEC filing. The U.S. Stem Cell Clinic is unsafe, falsely marketed, and should never be solicited for any medical procedure. I have been Grace Roberts. Thank you for watching. Stay informed and stay safe.